In today's episode of 2 Minutes with Tom, I'm going to revisit the office that I was in last week with one of the Life and Dentistry podcast founders, Dr. Daniel De La Cruz. And I want to tell you something that happened that day. So the title today is I Misjudged a Patient, My Bad. We all know from the very beginning of when we start in private practice, one of the pieces of advice that we get is to never judge a patient in any regard, how they appear, what you potentially think their willingness to accept treatment. Don't judge patients. And so one of the things that we did on that Saturday morning was to look at biofilms. I wanted the hygienist and I wanted the doctor, so we tested all the patients on a Saturday morning. So the very first patient that came in was an emergency patient, 8 o'clock Saturday morning with a toothache. And I was set up in an operatory between hygiene and the operatory. So I was looking at the x-rays as this emergency patient was being seen. And it was an older gentleman that had a lower molar that was completely bombed out. So I was saying to myself, great, let's get a biofilm sample. I'm going to be able to show you everything that there is to see. And so we got a biofilm sample. I put it up on the microscope. And lo and behold, from a periodontal standpoint, it was just extremely quiet. It was an extremely low risk. So this happened to be one of those patients that fall in a category of no periodontal risk, high caries risk. Okay, patients present three ways. They have perio risk, no caries. They have caries risk with no perio. Those are the ones that break your heart when you have to take out teeth that are perfectly sound, but they're periodontally involved. But most patients present with combined periodontal and caries risk. Okay, so it's very unusual to see that. So when I looked at this patient, I was like, oh my gosh, he's got this tooth that's completely bombed out. His microslide is completely quiet. His bone is really good. He doesn't have periodontal risk. He's 70 years old. He's not going to lose his teeth other than from dental caries. So that was the first patient of the day that I got tricked, because I thought he would present with a lot of things that I could show the office with. The last patient that morning was the exact opposite. It was a patient in her late 20s who, as the hygienist explained, kind of a little bit of a bloody prophy, but no pockets. Just, they put her on some Parodontax, some different toothpaste recently to try to get the bleeding under control. Great, let's get a biofilm sample and let's see where she's at. Put that slide under the microscope, and lo and behold, this patient, even though the patient was very young, was as high a risk as you would ever see. Spirochetes, banks and banks of white blood cells, parasites, amoeba, everything that you would see in an advanced periodontal infection, but the patient had no pockets. So in this particular instance, we are really doing this patient a huge service in doing a biofilm screening because we caught her at a very early phase. Now, she needs to be treated as aggressively from an antimicrobial standpoint as any periodontal patient. The good news is, because she doesn't have pockets and destruction, it'll be a very, very straightforward treatment plan as far as that goes. So when it comes to patients and their biofilm, it's kind of a tricky thing, and this is one of the problems when we are evaluating patients with the naked eye. I know that day in and day out, we are consistently making mistakes when we're not looking at the underlying biology.